Thank you all. And remember, we want to hear from you. We're taking live calls. The number is 713-741-8357. And now we'll move on to our next panel to discuss policy healthcare issues. But before we begin, producers Laura Lucas and Nancy Simons interviewed 3 different voices in our local healthcare debate: a health economist, the president of a major cancer center, and a health attorney.
I think the greatest problem we have is in terms of waste. There is evidence from a number of different resources from the medical literature and in collaboration with economists that have shown that 30% of our medical care is extremely costly and provides very little value and very little health gain to the patient. So we have to recognize that perhaps not everything that we're providing to the patients and not everything that we're receiving from our doctors is valuable, and we have to come to some sort of recognition agreement that we need to change the way we deliver care.
The healthcare system in Houston and Harris County is 2 healthcare systems. The majority of us, of course, have insurance, and the quality of care we receive is excellent. Some of the best in the country. The Texas Medical Center is fabulous. But over 1 million people, or nearly a third of the people in Harris County, are uninsured. And for them, health care is going in late, getting to the emergency room, not being followed up in a preventive way, but rather treating acute problems. And when they get to the hospitals, they get excellent care, but they're not getting it in the way they should be getting it. They should be going to clinics and regularly receiving checkups like the rest of us do, and have access to what medical knowledge knows to treat disease early and prevent disease.
I really do think we need to focus on universal coverage for children. I don't think it's widely known that in the Medicaid program in Texas, 1 in 3 children are covered by Medicaid. Medicaid, I think, has a sort of negative connotation, but Medicaid actually in our state is the program that covers the majority of children in Texas. The majority of the cost associated with the Medicaid program is actually spent on end-of-life care and on the elderly. So you can take from that the cost associated with covering children, even children who may be at the lower level, economic level, is actually pretty inexpensive. They're inexpensive to cover. They are our future.
In terms of what I'd like to see for our healthcare system, I think we're talking about major healthcare reform in this country. And one of the good things about the proposals that we're looking at is an agreement to get everybody covered by health insurance. So create incentives for employers to provide more health insurance, penalize employers who do not help their workers get an affordable health insurance, but also actually penalizing people who choose not to purchase health insurance as well.
We need to change the way we pay for health care, and we need to cover everybody. It can't be done in the next 3 to 6 months, but we all need to sit down and work together to develop a 3 to 5 year plan where we convert to a system which I hope still is run by private enterprise and public non-for-profit enterprise rather than run by a centralized governmental system. We have to work very hard to try to achieve that, and I think we can achieve it.
Children don't get to choose who they're born to, whether they're born to a highly educated or wealthy family or a family that's fallen on hard times. But they're our future, and it upsets me to live in a society where there are kids that don't get access to care. And coverage is one part, but access is the other part. And I don't think people really understand what access means. We need to make sure that once we cover children or adults, for that matter, that we have sufficient numbers of physicians who are trained to take care of them, who want to take care of them, who are paid to take care of them. We need to make sure that our hospitals get paid to take care of folks. I mean, I don't know that it's widely understood that in the Medicaid program, hospitals are paid only a portion of their costs, not their charges, their costs which means that the more children you see, the more money you lose. We have to change that. I personally think healthcare is the bedrock of everything. If you think about it, if any of us is sick and we can't work, we can't function. We can't pay our bills. We can't pay taxes. We don't fuel our economy. I think it is the basis for a society that I want to belong to, where people are healthy and they have access to care.
Our next panel is composed of Clifford Fry, Executive Vice President of RRC Inc., an economics consulting firm, David Lopez, President and CEO of the Harris County Hospital District, Karen Love, Executive Director of the Harris County Health Alliance, and Dr. Stephan Spahn, Senior Vice President and Dean of Clinical Affairs at Baylor College of Medicine. Thank you all for joining us. And I'd like to start with you, since you're blessed amongst men, Dr. Karen Love. There is a disparity here. We have the greatest medical center in the world, the most profitable, and yet we have the most people uninsured. Why the disparity?
I think there's a number of reasons for that in the Texas economy. I think it's already been pointed out that Texas has one of the stingiest Medicaid eligibility criteria in the country. We cover fewer people in Texas with the Medicaid program than most other states. So we don't have that safety net for a number of people. We have a large number of people who are undocumented and aren't eligible for public programs. We have a large number of small businesses. It's more likely that small businesses will not offer health coverage than larger businesses, and that's the prime economic engine of Texas.
I didn't get to ask all of you to state your where you stand on health care reform, so we'll start with Dr. Fry.
Well, neither the Senate or the House bill do anything to control costs at all. We have the Medicare broken, we have Medicaid broken, and we have an entire history of the government underpaying providers. The government doesn't provide health care, doctors and hospitals do. And to assign to the government with this history 1/6 of the economy is going to cause massive shortages in the United States.
Thank you, Mr. Fry. Mr. David Lopez.
Yes, I think what's been talked about before is that there's got to be an emphasis on primary care, prevention, and wellness as strategies. Right now, in the current system that we have, acute care is better reimbursed than outpatient care, and we need to make an emphasis on providing adequate reimbursement for outpatient care and really identifying those as major strategies that we need to have, and that becomes one of the key issues we need to be able to address.
Dr. Spahn.
We need to find ways to improve value in our healthcare system by improving quality and decreasing costs. I think we must increase access to care because patients getting care earlier get well and don't end up spending more and more downstream in their illness. We must strengthen our primary healthcare delivery system. It's been well shown that countries with strong primary care have higher quality of care, lower costs, and better patient satisfaction.
Karen Love, I'll let you go ahead and state your case.
I believe that we absolutely have to get everybody under the tent, whether that's through an individual mandate, whether it's through an employer mandate. We have to get everybody under the tent so that everybody has access to coverage. I think we've already talked this evening about the importance of aligning incentives amongst providers. Outside of the systems like Mayo, as you mentioned earlier, we have competing interests, physicians who are paid to do more and hospitals who are often paid a flat fee, so they're incentivized to do less. And we have laws that prevent them from working together to make that efficient.
We have a question from the audience right over here. Go ahead, sir. What is your question?
One of the things that I have not heard about is the administrative cost. My urologist tells me that he has one person that pulls medical records every day. I know of a country that has universal health care, and they have the patient take care of their own records. Now, I've been to several hospitals, and there's enormous rooms full of just nothing but records, which has got to be an enormous cost. I'm told that it costs us 30% in this country just for the paperwork. So I would like to hear some of you respond to that.
Any of you want to take that?
I'll be happy to address that. Yes, that is one of the areas of concern. There's a lot of regulations with HIPAA and with medical records that we have that makes the cost go up. We're trying to keep the cost down by, for example, going to the electronic medical record, which reduces the cost of that. But it is an area of concern with HIPAA, corporate compliance issues we have to have data on, and we have to maintain all kinds of records. It does add to the cost, and that's part of the area that we're trying to address. How do we do what we do today, maintain quality at a high level, but reduce some of the cost?
There are massive bureaucracies that will be created by these bills. And there are massive reporting requirements of your personal income to employers and all kinds of places in order to administer these programs that are contingent upon scaling subsidies to family incomes. There's a massive reporting under this system.
We have a phone call from TJ. TJ, what is your question, please?
I'd like to hear what the panelists have to say about some of the suggestions in Congress to repeal the antitrust exemption for the insurance companies to allow the free market to begin to really have a full effect on helping drive down costs.
Thank you for your question. Anybody want to take that?
I think one of the challenges that we see now is a system in which the insurance agents and the insurance companies are compensated on a percentage of their premiums. So where is their encouragement to offer lower cost affordable products, because that's going to eat into their premium costs. So I think we've got to balance the free market incentives with a mechanism by which more affordable products are put out there for individuals.
I got this email question. If 80 or 70% of Americans are happy with their health insurance, why make massive changes for the other 20 or 30%? Would you like to,
We're at
Mr. Fry?
crossroads, and we have a mixture of government and market forces, and to go toward a single monopoly government force is in my opinion, the wrong path to take. And there are ways to solve all of these problems with much better policies than are being proposed.
There's a question from the audience.
I'm galled by the fact that a publicly held company's CEO had to give $63 million back for an options problem he had when a neurosurgeon with how much education makes a fraction of that. And as a small employer, I'm one of the owners of a company with 6 employees. We spend 25% of our payroll on health care, and that's with a $2,500 deductible for individuals and $5,000 for families.
Anybody want to answer that?
We pay a lot more because of Medicaid and Medicare and the government underpayment of providers. And so they're increasing the cost to the private insurers because of it. And if you shrink the private insurers and move that into Medicare and Medicaid, you've got tremendous shortages. But remember, the government doesn't provide anything. It doesn't take from somebody else. And so all of this provision is a massive taking from a lot of people, and you're going to experience a massive tax increase in your business if this goes through.
There's no doubt, doctors, that there is cost shifting going on. How do we deal with the cost shifting? Dr. Span.
Well, I believe that to get rid of cost shifting, we have to get to universal coverage, universal access. We cost shift necessarily because, as a country, we do take care of people when they're severely ill, whether they have insurance or not. So the only way to pay for that is by cost shifting. If everyone is covered, then cost shifting goes away.
We do have Jeanette on the phone. Jeanette, what is your question?
Since we have so many undocumented illegal people coming into our Texas Medical Center, once they come into our system, they become, I would say, documented. Why can we not go back to their country of origin, such as Mexico, and demand payment from that country for their medical care, either monetary or in the takeover of their businesses or their interest to pay us for their care?
Thank you very much. This is a concern here. We have hundreds of thousands of uninsured who are people who are here illegally, and they are using our healthcare system. What?
Yes, they are. Let me just say, first and foremost, we believe in strong immigration reform, and that is certainly something we need to be able to address. However, once the individuals are here, it's no longer an immigration issue, it's a healthcare issue. We need to be able to address the needs of our community. We had a young lady show up at one of our hospitals who was a cook at a restaurant here in town that had typhus. We can't put her back in the community. We have to address her need because ultimately we need to do whatever we need to get done to improve our community's health and to keep health where it is today. So it is a very complicated issue. Let me also add that 80% of the volume that we have for the undocumented are women and children. And these are not the men who are here working. It is their families they bring over. So we need immigration reform, but once they're here, it's an immigration issue. It's a healthcare issue, not an immigration issue.
But I think we also have to come to grips with the fact that we as an economy benefit from these individuals working in our community, working at jobs that don't provide health insurance, working at jobs that provide low wages. We pride ourselves on having a very low cost of living here in our community. We're responsible for bringing people to our community and to bring them here, benefit from their low-cost labor, and to not have a system that provides them some access to care is inexcusable.
But just to address the caller's question, we can't go to Mexico or some other country and say, now you pay for the health care we provided. They don't. They just say no.
Let me also
they don't provide the health care there. They're not going to pay for it to be provided here.
Let me also add,
that's the problem.
Let me also, with the hospital district, I guess we're the major provider of care for the undocumented, but out of our total volume, it only represents 10 to 12% of our total volume that we see each and every year. So it's not a large amount, but it is an amount that we think is manageable.
We have another question from the audience.
Yes, my question is about senior citizens and them receiving inadequate care and their insurance programs that make it hard for them to have access to certain kinds of medical care.
Would anybody like to address them?
Some of the challenges are the reimbursement from Medicare. Medicare often does not pay, at least in the primary care setting, even the cost of providing the care. Some of the challenges are their difficulty in gaining access to pharmaceuticals. Many drugs are quite expensive, and we have patients with several chronic diseases that will have bills of $500 to $1,000 a month in terms of their drug bills. So, again, a lot of times it gets back to cost. Despite having Medicare, they still have to pay a lot out of pocket.
Talking about pharmaceuticals and drug prices, aren't we in a way as Americans subsidizing drug prices in other parts of the world? They buy from our pharmaceuticals, they can negotiate something that our country can't do, and so they're getting the same drugs for a lot less than we are.
Tricia, you're exactly right. And most of the innovation in medical equipment and drugs comes from the United States, and those are the benefits of having a market system, not a government-run system. And if we go toward a government-run system, innovation in medical equipment and drugs will be impaired, and the entire world is going to suffer because they really come here for good medical care, a lot of it.
If they can afford it.
If they can afford it.
Do you have a question?
Yes. I'd like to hear the panel's thoughts on how much study is going into what is happening in those single-payer countries. We're seeing single-payer countries that are having a private system and a public system because of access to care. We're seeing those countries with a single-payer system trying to hire our insurance companies to come in to run their system. Is anyone really studying what is working in a single-payer system and what is not?
There's a book called Lives at Risk, and it is a series of studies of the other medical provisions in the other countries. And they're exactly what you would expect with shortages. Long waiting lines, long waits for appointments, long waits for hospitals, and that's where we're headed with either one of these bills.
Dr. Spann?
I think we need to set the record straight, though, and we need to say that the data shows that many of those countries with single-payer systems have better health than we do. Their health care indices are way better than ours. So I'm not advocating a single-payer system, but they're not all bad.
I would like to ask you a question about the public plan and because we don't know if it's on the. It seems to be on the table. One day it's on the table, then it's not on the table. It might be on the table, but they're suggesting another option, which is healthcare cooperatives. What do you know about that, and how does that measure up to a public option?
Sure. Those are envisioned to be nonprofit organizations, community-based organizations, maybe even at the state level, where you bring providers together, where you can shop for health insurance amongst those employers. You pool people together, larger groups of people, to make the costs more affordable and allow people to find health plans that suit their needs and their budgets through those kinds of organizations.
We have a question from the audience.
Hi. One of our panelists mentioned that healthcare reform is is like a government takeover, and I just wanted to see if some of the other panelists could respond to that, because from my perspective, it looks like there's been a large role and a large place for private companies in maintaining as much as possible the system that we have now. Most of the proposals actually consider getting rid of CHIP, which is a government program, and putting those kids into private insurances. And if some of the other panelists could just provide some perspective on that.
From my perspective, I believe that if you have a good, a well-run government program, it can compete very well with private industry. Having said that, I do believe that a competitive environment between private industry and the government makes a lot of sense. To have a single-payer system, I think, creates a level of concern regarding what changes are made because there is no alternative, and so therefore, I think having alternatives is important for the healthcare system that we have today.
We have Winston on the line, please. What is your question, Winston?
Yes.
Yes. What is your question?
Okay. My first question was, why isn't the panel seem to be more diverse, and we can seem to be getting one view on this instead of having a diverse perspective of some of the questions asked? For example, one individual said that there'd be goodbye to innovation, but the government is well known for a lot of innovation, such as NASA, the National Oceanic and Atmospheric Association. So there's a lot of innovation with government intervention as well.
Anybody want to comment on what he said?
I would say this. I think certainly we want to keep innovation in our system. We want to keep the quality that we have right now and lower the cost. That becomes part of the issue. One of the areas that is not talked about in terms of how to lower the cost is that our system of health care cannot afford the expansion of coverage if we don't improve the health status of our communities that we live in. There are 4 areas that are causing major concern for our system of care. One is smoking, drinking, drug abuse, and obesity. If we could address those areas of concern, then we'll have a healthier community. But we cannot afford, no matter what reform happens, we cannot afford to continue the level of health status of our population and still have a system of care that's affordable. We need to be able to improve our community's health, and we're not even addressing that part of it in any of the part of the reform bill. But that's got to be addressed.
Mr. Karen Love?
I think we need to talk about the fact that innovation for innovation's sake is not the be-all, end-all. We've talked earlier about the fact that we continue to develop new diagnostic tools, new drugs, but we're not doing the kind of research and analysis to say, is the new drug better than the old drug? Is it more cost-effective? So simply to have innovation without proving the cost effectiveness of those innovations and taking some of the other older methodologies off the table will only continue to increase our costs.
First of all, the government will continue funding what it funds at the moment. What we're talking about is the change that is associated with these health care bills, and a lot of the innovation, there's billions of dollars being spent on improving drugs and equipment in the private sector, and this is where the slowdown in the innovation will come.
Do you agree?
Well, I think there will continue to be innovation. We've got to have that continue, and it's important that we do that. How we afford that and how that gets reimbursed remains to be seen, but ultimately there's got to be some way for that to be addressed.
Now, someone wrote an email, if we're required to buy insurance, we will only benefit the insurance companies. I won't be able to afford it. Please don't force it on me. Do you think premiums will go up if we have reforms?
No question.
No question premiums will go up?
No question, and if you don't buy it at the higher premium, you'll get a fine or a tax, whatever you want to call it.
If you develop co-ops, co-ops are going to be very, very selective in who they lead into their co-op. You're going to have to find individuals that are healthy, that'll keep the cost down. So in order to have premiums go down or stay the same, we're going to have to improve the health status of our communities. If we don't, then premiums will go up.
Yeah, but you have to find individuals that are healthy that'll pay high premiums.
I hope we have plenty of those.
For the young folks, that's what's going to happen.
Go ahead.
I work for an organization that represents seniors, and seniors are very worried. There was a discussion over here where it says we have Medicare Part E for everybody, and we talked about Medicare over here not being reimbursed. But you know that one of the proposed reform plans actually talks about a cut to Medicare. And I really want to know how we can cut Medicare and still provide services to seniors.
Any of you want to answer that?
I think that is a risk. I think if Medicare reimbursement to physicians is cut, there is a risk that more physicians will not take Medicare insurance. I think there are opportunities to reduce costs and eliminate waste in the system that go beyond cutting reimbursement to doctors. We have to find ways to use technology appropriately in a cost-effective sort of way, and there's a lot of opportunity there. So I don't think that the only way to reduce cost and eliminate waste is by decreasing the reimbursement to physicians.
Thank you. I would like to thank all of you and the panelists for sharing your ideas. And hopefully we'll find a better solution to this problem. And hopefully we've learned something from tonight. And if you'd like to share your thoughts, go to www.houstonpbs.org/have-your-say. We want to thank you for watching and participating this evening. As with everything we do here at Houston PBS, it is not possible without viewers like you. On behalf of all of us here at Houston PBS, have a great night. Thank you.
Production funding for Houston Have Your Say, provided by Sterling Bank. World-class banking, deep Texas roots.